Welcome everyone to the second Medical Minute. I'm Dr. Thestrup, Medical Director for Bel Air, and today I wanted to go over what falls under a class called extrapyramidal syndromes, particularly dystonic reactions. So real quick, extrapyramidal syndromes is this great big group of disorders that have a common feature, which is abnormal muscular activity, and really it falls under a group of movement disorders that are either hyperkinetic or hypokinetic. So in our case, the hyperkinetic disorders are dyskinesias or dystonic reactions. You also have something called akesthesias. You have tardive dyskinesias, and then you also have essential tremors. Now, under the hypokinetic, you have Parkinsonian type findings. But today, we're just going to keep it really simple. We're just going to keep it under dystonic reactions. So you can see what I'll shorten extrapyramidal syndromes into EPS, but you can see EPS symptoms in anybody who's on an antipsychotic. Other drugs that are common to this are TCAs, SSRIs, anti-Parkinsonian drugs, drugs like Haldol, flufenazine, also drugs like Phenergan, Reglan, metoclopramide, or prochlorperazine. I'm sorry, I'm having a tough time speaking today. But these are the common drugs that you can actually find these sort of symptoms under. Now, when it comes to our case, we recently had a great case of dystonic reaction. These are sustained involuntary contractions of muscle groups. So a lot of times you see repetitive twisting movements, abnormal posturing of the head and neck, and occasionally you may get some extremity involvement, but usually it's more of a central musculature origin. And really it comes from dopamine receptor blockade. That's where it all stems from. And usually it's after the most common reason is a large dose of antipsychotic meds. And sometimes these days when people do drugs, you don't know what they're cutting it with. They could be cutting it with an antipsychotic or some other drug that could be causing EPS syndromes. Now the risk factors for it are young age. Males tend to get it more frequently than females. Cocaine use as well. And then if you also have a history of acute dystonic reaction in yourself or your family. Usually has a very early presentation after exposure. It has rapid onset. It's about, the history comes in as a rigidity or spasms. A lot of times you'll have a history of antipsychotic medications. You'll also get some adrenergic hyperactivity. This is very common where you get someone who's diaphoretic, they're tachycardic, they're tachypnic, they're hypertensive, they're in obvious pain, and usually they're very, very anxious. They'll have some rigidity, some spasms, some tetany. You get a bizarre gait, some writhing around, some tonic contractions. Some common things that you can see is torticollis, which is actually abnormal involuntary neck movements, abnormal neck postures. You can get something called opisthotonus, which is actually back muscle spasm causing the head and lower limbs to bend backward and the body arches forward. I think some of you on the call the other day noticed this as well. Oculogyric crisis, you can get some rotary or some abnormal eye movements. You can also get something laryngospasm, which most of us know, but that is actually can be life-threatening in these cases and cause difficulty breathing or choking. There are also some other symptoms you can get, but I'm not going to go over those right now. Really, for our sake, there are really two main treatments. The first line treatment for us is providing some anticholinergic medication. And for us, that's going to be Benadryl. And it could be 50 milligrams IM or IV. And then what we can also give if they're having really bad spasms is a little bit of a benzodiazepam. So a small dose of Versed. This is not a typical drug that we give for this. So if you have any questions about it, just give me a call and we can discuss the case and happily give it. But anyway, I just wanted to go over dystonic reactions. And like I said, there are other components that fall under EPS. But today we'll just cover this aspect of it. And again, if there are any questions or any concerns, feel free to give me a call. Thanks, guys.